Well, if you have a family history of cancer, then you should really be mindful, particularly if you see signs that are weird for your body. Lots of people still cannot spot the signs of cancer. The cancer market promotes awareness for several cancer types. That's why we miss out on the signs of cancer and act far too late. It's very important to understand as much as possible the early indications of cancer due to the fact that early detection is the best prevention. Here are 5 cancer caution signs which bulk of individuals presume aren't harmful. Number 1, a change in bowel habits. Most changes in bowel habits are related to your diet and fluid intake. Doctors sometimes see pencil-thin stools with colon cancer. Occasionally, cancer exhibits continuous diarrhea. Some people with cancer feel as they need to have a bowel movement and still feel that way after they've had a bowel movement. If any of these abnormal bowel complaints last more than a few days, they require evaluation. A significant change in bowel habits that cannot be easily explained by dietary changes needs to be evaluated. Number 2, a change in urination. Urinary symptoms can include frequent urination, small amounts of urine, and slow urine flow, or a general change in bladder function. These symptoms can be caused by urinary infections, usually in women, or in men by an enlarged prostate gland. Most men will suffer from harmless prostate enlargement as they age and will often have these urinary symptoms. These symptoms may also signal prostate cancer. Men experiencing urinary symptoms need further investigation, possibly including blood tests and a digital rectal exam. The PSA blood test, its indication, and interpretation of results should be discussed with your healthcare provider. If cancer is suspected, a biopsy of the prostate may be needed. Cancer of the bladder and pelvic tumors can also cause irritation of the bladder and urinary frequency. Number 3, lumps in the testicles. Most men, 90%, with cancer of the testicle have a painless or uncomfortable lump on a testicle. Some men have an enlarged testicle. Other conditions, such as infections and swollen veins, can also cause changes in your testicles, but any lump should be evaluated. Men are advised to conduct monthly testicular self-examinations. Number 4, breast lump or breast discharge. Most breast lumps are non-cancerous, such as fibroadenomas or cysts, but all breast lumps need to be thoroughly investigated. Discharge from a breast is common, but some forms of discharge may be signs of cancer. If discharge is bloody or only from one nipple, further evaluation is recommended. Women are advised to conduct monthly breast self-examinations. Number 5, indigestion or difficulty swallowing. Most people with chronic heartburn usually do not have serious problems. People who suffer from chronic or lasting symptoms, despite using over-the-counter antacids, may need to have an upper GI endoscopy. A condition called Barrett esophagus, which can lead to cancer of the esophagus, can be treated with medication and then monitored by a doctor. Swallowing problems need to be investigated because nutrition is always important. Difficulty swallowing solids can be seen with cancer of the esophagus.